Let's begin with the second section, and in this section now we will talk about some examinations that can be done on the cerebrospinal fluid. We can do the typical profile of cerebrospinal fluid, CMV infection and PMN pleocytosis, markers of specific viral infections, and also we will talk about the viral culture. So CSF examination. CSF stands for cerebrospinal fluid. It's the fluid that flows around the brain and spinal cord. Typical profile: pleocytosis, normal or slightly high protein concentration, normal glucose concentration, normal or mildly elevated opening pressure. So that's the typical profile. Pleocytosis, increased cell number, normal or slightly high protein concentration, normal glucose level, normal or mildly elevated opening pressure. Organisms are not seen on gram stain of cerebrospinal fluid because it's the viral meningitis. Next, total CSF cell count is in viral meningitis, it's about 25 to 500 per microliter. With infections due to LCMV, lymphocytic choriomeningitis virus, and mumps. Lymphocytes, predominant cell in cerebrospinal fluid. In first 48 hours of illness, polymorphonuclears may be predominant. PMN, polymorphoneutrophils, pleocytosis in 45% of patients with WNV meningitis, Nile virus meningitis. So this is some characteristic features we discussed of cerebrospinal fluid. So the total cerebrospinal fluid cell count in viral meningitis is about 5 to 500. Lymphocytes usually are predominant cells, but usually in the first 48 hours, polymorphonuclear cells may predominate, and usually they predominate overall in the infection caused by WNV virus. Next, CMV infections. Polymorphonuclear pleocytosis in CMV infection, cytomegalovirus infection. Low glucose level is in immunocompromised host. So if the meningitis is caused by cytomegalovirus, usually there is polymorphonuclear pleocytosis. Increase the polymorphonuclear neutrophils are present. Polymorphoneutrophils are more. They are predominant. There is low level of glucose, and it's more common in patients who are immunosuppressed and immunocompromised. So now we are talking about CSF characteristics in different infections caused by different viruses. So CMV in immunocompromised, low glucose level, neutrophils are present. PMN pleocytosis, considering alternative diagnosis, bacterial meningitis, parameningeal infections. CSF glucose concentrations, typically normal concentrations. Decreased levels are present in 10 to 30% of cases, due to mumps or lymphocytic site meningeal virus, glucose level is decreased. Due to ecovirus and other enteroviruses, herpes simplex type 2, varicella-zoster virus. So glucose level, typically the concentration of the glucose is normal. But if the level of the glucose is low, that gives us the rough idea that what viruses can be associated with this. It can be the mumps and LCMV, can be herpes simplex type 2 or varicella-zoster virus. Lymphocytic pleocytosis plus glucose, low glucose. Now, which viruses are involved? It is fungal or tuberculous meningitis. Now, if the level of glucose is low, but along with that, not polymorphonuclear pleocytosis, it's lymphocytic pleocytosis. Now, it might be the fungal or tubercular meningitis. Listeria meningoencephalitis is also associated with lymphocytic pleocytosis plus low glucose level. Non-infectious disorders like sarcoid neoplastic meningitis. So this gives us a very good idea about if the concentration of the glucose in the cerebrospinal fluid is normal, what can be the viruses involved. If it's low, what can be the viruses that can cause meningitis. If it's low, along with lymphocytic pleocytosis, now it's not mainly because of fungal infections, tuberculosis, or non-infectious conditions that can cause meningitis. Markers of specific viral infections. Now, what are different markers which are associated with specific virus associated with meningitis? We said we have Coxsackie virus, enterovirus, herpes simplex virus, then we have HIV virus. What are the specific markers associated with these viruses? C-reactive protein is one marker. Lactic acid, lactate dehydrogenase, neopterin, quinolinate, interleukin I beta and interleukin 6, soluble interleukin 2 receptor, beta 2 macroglobulin, and tumor necrosis factor, TNF. These are all the markers. If they are present, it's an indication that we have meningitis caused by specific viruses that can cause meningitis. Viral culture. Next, the culture of the virus. Specific viruses, isolation from throat swabs, enterovirus, mumps, adenoviruses we can culture from the throat swab we can get. Stools, enteroviruses and adenoviruses. Blood, we have adenoviruses, some enteroviruses and LCMV. And urine, which is mumps and CMV. So these are all the sources from which the specimen can be obtained to look for the specific virus by the culture of the virus, and then we can find out what's the causative virus so the treatment can be done. Enteroviral infections, viral shedding is in the stool. Entero is for the intestine. So naturally these viruses, they shed in the stool. So enterovirus, they shed in the stool. May persist for several weeks in the stool. Presence in the stool is not diagnostic of the viral and enteroviral meningitis due to previous infection, maybe in some asymptomatic individuals also. So enterovirus is shed in the stool, so we can get the specimen from the stool sample and do the culture of the enterovirus, but it persists in the stools for a long time. So it may be not diagnostic of the infection, it may be indicative of some previous infection or persisting infections. So that was our lecture 2, in which we talked about some characteristics of cerebrospinal fluid and the viral cultures. Thank you for watching sqadia.com.